So today we're going to talk about headaches. So the question is, well, how does it get started? Why does that happen? Well, you can have an injury, not a direct blow to your head, but you could have an injury to your neck. You fell down the stairs, you got jarred. You're running on the soccer field, you get jarred. These muscles become tight and irritated. Most times it's coming from something stress related. It could be how you're holding yourself when you're sitting at your desk at work. It could be that you're stressed mentally about something and you'll carry that stress right here. And again, that's those same muscles that get tight, pull on the base of your skull, put that pressure on the brain, and that's what gives you the headache. And the last thing that really can cause an external headache again, or be from an external cause, is just overuse. So if I've been doing a lot of overhead activities, or I've been doing a lot of movement with my head, I've been sitting for a long period of time, these neck muscles start to get tight and stiff and sore, and they will start to contract, and they will start to pull on the base of my skull, and it'll put some inward pressure on the bone, and the bone then puts pressure on my brain, and that's what gives you the headache. But it all comes from an external component, that being the muscle. Most typically, a headache will come from or start as a result of you've been sitting for too long. So you're sitting at the computer, you're looking forward, you're sitting looking at your phone, your head's in that position, you're driving for a period of time, your head's in that position for an extended period of time. Well, what's happening during that time is that those muscles are starting to get tighter, so they're pulling down on the base of your skull. That pulling down creates tension on the muscles on your head, they get tight, they put pressure on the skull, and ultimately that pressure on the brain, that soft tissue inside of it. It can also come from just muscle fatigue. So if I'm just tired in general, if you ever get a headache more towards the end of the day, it's because all of these muscles, again, running from your shoulder blades up into your neck, are getting tired. When a muscle gets tired, it gets tight. So that muscle gets tight, and again, the same thing happens. Pull on the base of the skull, pressure on it, puts pressure on the brain. All of these ultimately increase the tension in the muscle. And so when the muscle again is pulling, it's pulling down on the skull, it's putting that pressure, and it's creating things. Now, in addition to pulling on the skull and creating a headache, you can also begin to get some neck pain. But most typically, if it's going to cause a headache, those two will be separate problems. But again, those muscles are pulling, putting pressure on the skull, and ultimately putting pressure on the brain inside of it. Well, what really needs to be done to take care of it? Well, if you've ever had a headache and you just notice that you get into an area that's dark, quiet, and you lie down, things feel better. That's great. The reason for that is when you lie down, all of those muscles that were tight and tense and working hard or having a hard time holding your head on top of your shoulders, remember it's like a bowling ball, all of those muscles shut off. So they stop pulling on the base of the skull, you start getting that pressure, and the headache starts to subside. You might take Advil, Tylenol, aspirin, whatever, and what that does is it's getting the muscles to shut off and not be as tight or as tense. But the biggest concern is, well, what caused it in the first place? Well, something brought it on. It was that stagnant position. It was that fatigue. It was that stress, whatever it might be. And the concern is that that continues to happen time and time again. So yes, it's great to lie down and get that taken care of, but what happens when it comes back 3 days later, or 3 weeks later, or 3 months later? Those are a little bit of a warning sign that if it's happening regularly, that the problem is actually progressing. It's not just this one-time event. These headaches are kind of warning signs. It's like that check engine light that's going off that tells you that something's happening. Those muscles in your neck are weaker and tighter than they should be. And that's what's allowing this pressure to occur as you sit at your computer or you sit in traffic. It can progress to a point where you start to experience what would be termed migraines. So those would be very intense, longer lasting headaches, because at that point the pressure has switched from the outside. Now the pressure was there so consistently or so long that your brain has actually swelled a little bit and is now pushing itself against the skull. Headaches, again, are a warning sign that something in your neck isn't right. It isn't the way that it should be. And so that's a warning sign that some problems could be starting to develop in terms of compression down on the spine with discs and pressure on nerves and things like that. So very commonly, we'll see somebody that had a neck problem. They show up because they've got symptoms down their arm. And we go back far enough in history, whether it's a couple of months or a couple of years, and they'll tell you, I used to get headaches all the time. That was the warning sign that was telling us that something wasn't right in the neck, and it was beginning to create this problem that was going to get worse and progress later on. How do you take care of all this? Well, the number one thing is, obviously, to get your headache under control, you need to get that muscle tension under control. You need those muscles to be more relaxed. Yes, it's great to find 10 minutes when you get home from work or at the end of your day and go lie down and lay in a dark room and get the pressure off and get that headache to go away. But the bigger question is, why did it come on in the first place? Well, what's happening is in those muscles in your neck, those muscles, they should be straight fibers, and what's happening is those muscle fibers are getting all knotted up and balled up on each other. They relax, but they still stay in that knotted, balled up state, which is why you get a headache a day later, a week later, or whatever it might be. So what you really need is for a physical therapist to use their manual treatment skills to get into those muscles and realign those muscle fibers. Now you're going to say, I could do that with massage. The answer is yes, you could do that with massage. It will take those muscles from being tight and guarded, and it'll get them to relax, but they'll still be all knotted up on each other. That requires some very specific manual skills that only a physical therapist possesses. Get those muscle fibers to realign with each other, and lo and behold, not only do your headaches go away, but the headache isn't going to come back. The problem that's causing it to keep coming back is now going to be taken care of. Best of all, you prevent yourself from having future neck problems or developing migraines, etc. In addition to that, once those muscle fibers get lengthened out and straightened out the way that they should be, we need to make sure that they stay stretched out. You need to learn some strategies. If you ever start to feel a little bit of a tension there, because it's going to happen, what do you do right away that keeps this from starting all over again with those muscles? And then more importantly, the stronger that a muscle is, and these are muscles that are, again, like the size of your thumb that are holding your bowling ball head on top of your shoulders, the stronger that that muscle is, the better job they're going to be able to do to hold your head up. So that again, as you're sitting at the computer and gravity takes over the course of the day, and this is where you end up, you can tell yourself, sit up straight. 30 seconds later, you're right back into that same position if those muscles aren't strong enough. So the key to getting your headache under control and keeping it from coming back is get those muscle fibers to be lengthened out. Again, only a therapist trained in manual therapy skills can do that. Get those muscles to be long so that they stop pulling and putting that pressure. And then more importantly, get them to be good and strong so that they hold you upright. You don't have to tell yourself, sit up straight all day long, sit up straight when you're in traffic, etc. And then even when you get stressed out at work or with the kids or whatever it might be, those muscles are stronger. They don't need to tense up to handle that stress the way that they do. And before you notice, your headaches are going to be gone and you're not going to be having headaches anymore. So if you're having any headache problems, internal or external symptom-wise, any headache symptoms, any progression of symptoms, etc., give us a call here at Loudoun Sports Therapy Center. That's what we do. We get the problem under control so that you feel better, but then we make sure that you know what to do long-term so that A, it's gone, and B, it's not going to come back and it's not going to cause you any future problems.